My name is one Azman, one Ahmad. I'm presenting on the behalf of the sirolumus-coated balloon de novo investigator. I'm affiliated to Malaya Medical Centre. The title of our study is a randomized trial of sirolumus-coated versus paclitaxel-coated balloon in de novo coronary artery lesions. Paclitaxel-coated balloon is recommended and well established in the treatment of narrowed or blocked coronary artery which were previously treated with stent. This is called in-stent restenosis. Currently, paclitaxel-coated balloon is gaining acceptance in the new blockage, what they call de novo coronary artery disease. However, what's not clear whether there's an alternative drug, a sirolumus drug can be alternative to the paclitaxel-coated drug. So the advantage of drug-coated balloon is that we do not leave any foreign implant. So this is a preferred strategy because we avoid inflammatory response to the vessel wall. This is in line with the concept of leaving nothing behind. So we study the novo sirolumus balloon. This balloon, the drug is about 4 micrograms per millimeter square, is crystalline coated, and the excipient is a butylated hydroxytoluene. Yes, persistent vessel concentration of up to 50% of the initial concentration at 1 month. So we compare this balloon with the well-established paclitaxel-coated balloon that is sequence neo 3 micrograms per millimeter square to determine the efficacy and the safety of this balloon.